My name is Cass Gorton, and I'm delighted to share with you some of the important work being done at Monash Health around an increasingly concerning topic in scholarly communication: predatory publishing. Before we begin, I'd like to acknowledge the traditional custodians of the land on which Monash Health operates, the Bunurong and Wurundjeri Woi-wurrung peoples of the Kulin Nation. I pay my respects to their elders, past and present, and recognise their continuing connection to land, waters, and culture. We're going to explore how our library has approached the challenge of identifying and addressing predatory publishing within a clinical health network, and how you, as information professionals, can apply similar strategies in your own institutions. Let me give you a quick snapshot of where this work took place. Monash Health is Victoria's largest public health service. It employs over 20,000 people across 7 hospitals and a wide range of community-based services. The library team supports this massive network through 5 physical library locations and a team totaling 6.3 FTE. Our budget and resources are focused on clinical content. This context, clinical, fast paced, and heavily research informed, is critical to understanding why predatory publishing is such a concern for us and why we need to address it in a low cost method. Let's start with a shared understanding. Predatory publishers often present themselves as legitimate open access journals, but in reality, they undermine scholarly communication. They charge authors fees to publish without offering proper peer review, editorial standards, or indexing in trusted databases. In a healthcare setting, the risks are particularly high. If a practitioner reads flawed research that was never rigorously reviewed, the consequences can directly impact patient care. Most importantly, there is no consistent or singular method for identifying a predatory publisher or journal, and we're going to come back to that in a second. Monash Health Library already has an established reputation with predatory publishing education. We created this comprehensive poster in 2022 to assist our users with identifying predatory publishers. And if this looks vaguely familiar to you, that's because TEXA actually adapted it in the same year. So we already have a passive approach to predatory publishing in our organisation, but we wanted to take a more active stance. At Monash Health Library, we wanted to understand the scope of this issue within our organisation. We set out with 3 clear goals: identify articles by Monash Health affiliated authors that were published in potentially predatory journals, assess those journals using a structured risk rating method, educate and support researchers to help them make informed publishing choices. This wasn't about naming and shaming, it was about awareness, education, and support. So, how did we achieve this? As I pointed out earlier, there's no single definitive way to identify whether a journal is predatory. This graphic helps illustrate that point. There's often significant overlap between various classification systems. For example, a journal that might be listed as legitimate in Cabell's whitelist may also still appear on Beall's list. Another might meet the technical criteria for inclusion in the Directory of Open Access Journals, but also be flagged as predatory in Cabell's reports. This overlap creates confusion, not just for researchers, but even for experienced librarians. It shows us that predatory publishing exists on a spectrum, not as a simple yes or no designation. And that got us thinking, what if, instead of trying to force journals into a binary model, predatory or not predatory, we developed a rating system that draws on the strengths of all of these tools? By using multiple free sources, like indexing lists of databases, archival lists like Beall's, DOJ criteria, and even basic publishing standards, like having an ISSN, we can build a more nuanced, evidence-based risk profile for each journal. Each of these sources have criteria of their own we can leverage and aggregate. This was the inspiration behind the structured scoring method we adopted at Monash Health. It allowed us to look beyond black and white labels and support researchers with more practical, informed approach to journal evaluation. To bring structure and consistency to our assessment, we developed a simple scoring system. Each journal could receive 1 point for each risk factor it met, and those are listed on the slide. Once we had the total score, we used that number to classify the journal's risk level. 0 points meant no risk, 1 to 2 points indicated a low risk, 3 to 4 points suggested a medium risk, and 5 to 6 points placed the journal in the high risk category. This approach helped us move away from vague or subjective judgments. Instead, we had a clear, transparent method for evaluating journals based on identifiable criteria. It also allowed us to prioritize our efforts, focusing on the most concerning cases first, while still acknowledging that not all questionable journals pose the same level of risk. This method could be adapted for any academic environment. Medline is the only medicine specific resource here that could be replaced with another free index that uses their own evaluation criteria. We applied this criteria to the outputs in our research repository. Here's what we found after reviewing the data. 85.9% of journals were of no risk, 11.4% were low risk, 2.4% were medium risk, and only 0.3, a very small proportion, were high risk. When we first analysed our repository, we found that around 14% of journals flagged fell into the potentially predatory category. At first, this raised a question. Was our rating system too sensitive? Were we casting too wide of a net? To put this into perspective, a recent study focused on Elsevier journals estimated that predatory publishing accounts for roughly 2% of medical research articles. If we narrow our focus to only the medium and high risk journals from our own study, the categories of greatest concern, that percentage drops to around 2.5%. This suggests that our approach aligns fairly closely with external research and provides a balanced, cautious framework without being overly alarmist. Something that really surprised us during this project was that not every journal from a so-called predatory publisher was actually behaving in a predatory way. We noticed that editorial practices could vary quite a lot between journals, even when they came from the same publisher. So painting an entire publisher with a single brush might not always be accurate. A good example of this is MDPI. You might be familiar with it. It's a large open access publisher with over 430 journals. MDPI was previously listed on Beall's list, mainly because of their aggressive tactics, like sending unsolicited emails to authors inviting submissions. I myself have received 2 solicitation emails this month from an MDPI journal. But when we take a closer look at individual journals under this banner, we found a real mix. Some had rigorous editorial processes, others not so much. So again, it highlighted that we need to look at journals individually, not just judge them by the publisher name. Interestingly, Professor Emmanuel Andreas, who is the editor-in-chief of the Journal of Clinical Medicine, which is an MDPI journal, recently published an op-ed. In it, he argued that the term predatory is sometimes used by big established publishers to discredit new open access journals and maintain this market dominance. So it's a really charged and evolving conversation. We also looked at the cost. In total, we identified 4 journals that were considered high risk. Only 1 article had been published in each of them, but collectively, the APCs added to nearly $9,000. That's a big investment, especially when it's coming from public health for a small number of potentially questionable publications. When we looked more closely at the journals in question, there were a few telltale signs that something wasn't quite right, and a lot of it you can just spot by looking at the journal's website. The layout, design, and overall presentation often looked unprofessional or thrown together. Sometimes there were broken links, placeholder text, or inconsistencies in formatting. And while appearance isn't everything, it can definitely be a red flag. We also noticed that the metrics they displayed just didn't check out. They either couldn't be verified anywhere reputable or were presented in a suspiciously vague way. And that's a warning sign. Another big clue was the unusually fast turnaround times they advertised for peer review. Some journals were promising publication in just a few days after submission, which, as we know, is pretty unrealistic if genuine peer review is happening. That said, not everything was fake. In this example, the Clinical Practice Journal, it did actually have a registered ISSN that we were able to verify in the official registry. So while the other signs are concerning, it's a reminder that legitimacy isn't an always all for nothing. Overall, it's a good example of why we need to approach journal evaluation with a mix of skepticism and curiosity, and not rely on any single indicator alone. And then the same case, which was this journal, which is part of the same publisher. Again, it had a real ISSN, but everything else couldn't be verified. Interestingly, these next 2 journals were indexed in Scopus, which is quite disappointing. So, what did we do about this? As part of our project, we reached out personally to each researcher who had published in what we classified as a low or medium risk journal. We decided to focus on articles published within the last 10 years. Our thinking was, people grow. publishing decisions from a decade ago might not reflect the current practices of or awareness, and we wanted to approach this from a place of learning, not judgment. When drafting these emails, we were extremely careful with our language and tone. The goal was to never accuse anyone or make them feel embarrassed. Instead, we framed our messages as supportive and informative, simply sharing what we'd found and why it might be worth revisiting. And most importantly, we always ended with a message of an open offer, whether that was for more information, guidance on publishing choices, or even just to chat and talk it through. This part of the project really underscored the importance of relationship building and empathy in our roles. It wasn't about catching people out, it was about opening up opportunities for reflection and support. So, most of the researchers we contacted didn't reply, which, to be honest, we expected. These are sensitive conversations, and not everyone feels comfortable engaging with them, and that's okay. But the responses we did receive were really insightful. They highlighted a clear need for more support and clearer information around scholarly publishing. A few common themes emerged: confusion between citations and quality. Some researchers assumed that because a journal had been cited, it must be reputable. This shows how easily metrics can be misunderstood or misused. Another uncertainty around author responsibility. Should it be the corresponding author's job to choose the right journal? And overall, there was a sense of being frustrated by the complexity of the publishing landscape itself. And honestly, that's a fair point. With the rise of open access, evolving metrics, and shifting standards, navigating where and how to publish is more challenging than ever. So, for us as librarians, this reinforced the need to be proactive in providing ongoing education and tailored support, not just on predatory publishing, but on the entire research and publishing process. We didn't just stop at identifying problems, we wanted to be part of the solution. So we went a step further and developed new services to better support our researchers in navigating the publishing landscape. One of the most popular has been a recommendation report. Researchers can send us their manuscript or even just an abstract, and we'll create a tailored list of reputable journals that match the content, study design, and intended impact. We also include information on impact factors, open access options, and importantly, article processing charges, so they can plan ahead and avoid surprises. We also developed a researcher impact report. This breaks down their H index, actual citation metrics for their publications, and crucially, what those numbers mean. It's been especially helpful for researchers preparing grant applications or promotion documents. And now for something we're really proud of. Thanks to the Victorian Health Libraries Consortium, we've been able to negotiate read and publish agreements with several reputable publishers. This is a huge step forward. For years, publishers have been reluctant to negotiate with hospital libraries, mistakenly assuming that our researchers were covered under university-based call agreements. But the reality? At Monash Health, fewer than 3% of our staff have university affiliations. So these new deals are a game changer in supporting equitable access to publishing opportunities for our workforce. And of course, we've continued our education series, lunchtime sessions covering topics like publishing pathways, metrics, and open access. We run them live, but we also record everything so clinician researchers can catch up at a time that suits them. All of these initiatives come from the same place, helping our researchers make informed, powerful decisions about where and how they published. Thank you very much for your time, and if you have any questions, please get in touch.